Each day we know how mental health and wellness is central to our well-being and how behavioral health professionals can provide a range of care to anyone that may be having challenges, be it anxiety, depression, or a variety of other mental health concerns. To shed some light on this fascinating world of behavioral health, with us today is Cindy Davis, Workforce Manager for the Missouri Behavioral Health Council. Cindy, welcome to Healthcare Career Day. It's great to see you in the Zoom.
Oh, great. It's so great to be here. Do you want me to just jump right in? I know we're a little behind times, maybe.
No, we are good. We are good. Welcome.
Okay. So yes, like Brian said, my name is Cindy Davis. I work for the Missouri Behavioral Health Council. Very excited to be with you today. I know there's a lot of folks watching. But before I tell you why I'm here, I wanted to share with you about a study I read that showed that people were more engaged and liked your presentations more if you have slides that make them feel good and smile. So here you go. Next slide. So I may not have any cool videos of ambulances and operating rooms. So today I'm winning you over with puppies instead. So who doesn't love puppies, right? Okay, next slide. Oh, and one more. It may not be those newborn babies that you just saw, but tiny kittens are pretty good too. So anyway, done fooling around. Next slide, please. So again, my name is Cindy Davis. I work for the Missouri Behavioral Health Council. And much like the Hospital Association represents hospitals across Missouri, we represent community behavioral health centers across Missouri. And I want to explain to you what behavioral health really means. Generally, it refers to mental health conditions, substance use disorders, life stressors like trauma, loss, relationship issues, and more. Behavioral health care is the prevention, diagnosis, and treatment of those conditions. And you'll hear people use both mental health and behavioral health interchangeably, and they really mean the same thing. And so I wanted to clarify that in case there was a confusion about that. A huge focus of ours is reducing stigma. There's a stigma that sometimes can be associated with behavioral health conditions, but come on, we all have a mind, we all have a brain, and we all have a body. And when we're sick with the flu or broken bone or some other diagnosis, there's absolutely no question that we would go seek help and find a doctor. But when it comes to mental health treatment, we don't always think about it the same way. But I'm here to tell you, as important as your physical health, your mental health is just as important. And luckily, the world's changing and evolving, and hopefully we'll get to a place where caring for your mental health is just as normal as caring for your physical health. And the 988 Crisis Lifeline has really helped with that. I know all schools have been educated and they post information about 988. So one of the messages I wanted you to hear today is that it is okay to ask for help, and it's okay to find help if you're struggling. And it's also important to reach out if you think a friend or a family member might be having a hard time, because we're all in this together and we really need to help care for each other. Another obstacle that we face in behavioral health care is folks knowing and understanding the jobs we do. For example, everybody really knows what a dental hygienist is or a pharmacy tech. But when we use job titles like community support specialist or crisis outreach specialist, not everybody understands what those jobs look like and what they do. So we're working to spread the word across our communities, and that's one of the greatest things about being here today and having so many people hear our message at once. So next slide. We have community behavioral health centers all across Missouri. We have more than 30 agencies who provide mental health and substance use treatment to any Missourian who needs it. So this slide shows the logos of all of our providers. You might recognize some of these in your part of Missouri. Each of these agencies are always looking for qualified, dedicated people to come work with them and make an impact and to help our communities be stronger. Next slide, please. So a few things I want to tell you about today. We've been working with the Department of Education and the Department of Mental Health to build a certificate program for high schools. So coming soon, it's not out yet, coming soon, the Behavioral Health Technician Certificate. This is a program where students will learn what they need to know to enter a behavioral health field. It's also a good starting point to work towards different degrees and a lot of career possibilities in our field. Also, when you start to explore behavioral health early, you can discover your interest in the field, develop a passion, make better, more informed decisions about your education and your career. And you'll develop skills like empathy, communication, fundamentals of behavioral health, problem solving. All these skills are really important for careers in behavioral health. And earning the certificate can also enhance your resume, making you more competitive for colleges or job opportunities, as well as you'll learn things that will just make a difference to you and your family and your communities. We're in the process of developing this with learning courses, video storyboards for students and advisors, and a teacher's guide. We're going to have a webinar on May 1st, I believe, for any interested career center, and then hope to roll out the program to our pilot schools in the fall of 2025. Next slide. We've also developed an associate's degree of applied science in behavioral health support that's offered at a lot of community colleges in Missouri. This program is to prepare students for employment in behavioral health immediately upon graduation. It's a hands-on program of 62 credit hours in a classroom or virtual setting, and then 300 or more clock hours of practicum experience at actual healthcare settings. So it's usually one of our agencies, and students then, they were talking about internships or job shadowing, so these practicums really allow our students to get to know the agency and the agency to know the student, and usually job offers follow their graduation from those programs. So anyway, you can also complete that program sometimes at an accelerated pace and graduate in like a year and a half or so. So the colleges that offer this program, I have them listed: Ozark Technical, North Central Missouri College, St. Louis Community College, Three Rivers, State Fair, Moberly Area Community College, Missouri State University, West Plains, Crowder, and St. Charles. And we have a few that are a few more that are hoping to launch a program soon. So, and I'm pretty sure all these programs are Pell Grant eligible, which is really helpful to students too. So speaking of money, next slide, please. We've also developed a scholarship program, the Roy Blunt Behavioral Health Scholarship. Roy Blunt is a former Missouri senator. He was and is a huge champion of behavioral health. He created a legacy in Missouri, improving and expanding access to health care for all Missourians. This scholarship is a tribute to him and his legacy, and it supports students who want to invest their education in the field of behavioral health. So it's pretty exciting. Last slide. So I'm happy to take any questions. Brian, I'm not sure if I have time, but I wanted to give you my email address here on this slide. So please feel free to reach out to me if you have any questions. And student advisors or counselors, if you would like any more information, please reach out. And that's our website, www.moenbhc.org. And it has a list of our providers, advocacy efforts, community outreach, crisis services, prevention, recovery, and information about that scholarship too. So with that, I'm all talked out. So hope to hear from you soon.
Outstanding. Thank you, Cindy. Thank you so much for joining us. And we actually do have some questions coming through. I believe, if we can, a school right around your corner, Nichols Career Center, the health science program there in Jeff City, would like to ask you a question, Cindy. Nichols Career Center, you have the comms.
So how do you go about treating a pediatric psychiatric patient versus an adult psychiatric patient?
Well, so typically, the best, we try to meet our clients. We usually call them clients, not patients, but we usually try to meet our clients where they are. So if we have counselors who come into the schools who are specifically educated to understand the specific needs of children and adolescents, family dynamics, things like that. And so lots of time, and then typically when we're treating kids or youth, we also involve the rest of the family as well, their guardians, their caregivers, because it's sort of a team approach when you're treating children and kids, because it's not just what happens with that kid, with that child, but also what happens to them at school and what happens to them with their friends and what happens at home. So treating them in a kind of a whole group setting is really, really important.
Thank you.
Excellent. Thank you, Nichols. Appreciate you coming in. So, Cindy, I think we had a couple questions through the Zoom chat. Let's see, real quick. We had a student ask, what do you think about starting a support group for high school students?
So like so what is really important is for if you have a support group at your high school, getting involved and making sure that folks know about it. And then any of our counselors as well at any of our agencies, if you need to have somebody direct that support group, they can provide that counselor for you. Most of our agencies have relationships with their school districts and do lots of things inside the schools. So they would be more than happy to come and facilitate a support group, and then when you gather, learn from each other. So,
and we have one last question that came in. This is a good one. How do you manage to keep others' mental health and your own separate? In other words, how do you keep your composure when you're helping your traumatized patients?
True. So yeah, all of our counselors, they learn boundary setting, and they learn how to hear the things that their clients are saying and be able to help process them through that, but then be able to disassociate themselves when they leave for the day. But I'll tell you, there is such thing as secondary trauma. So there's a lot of our counselors who also have therapists and get counseling, because it's hard. Sometimes it's a difficult thing when you're hearing someone's trauma, or if it's something that could possibly trigger an old trauma that you experienced. And so they help each other, but mostly boundary setting is what is probably most effective for our counselors and therapists.
Yeah, outstanding, because you do have to take care of yourself just as much as your patients. So it's good to hear.
And we really do try to not only preach, but live our own self-care, and recognizing that taking a pause, taking a break, and taking a break from social media, and getting out in the fresh air and having the sun on your face, is all really, really good things to help keep your mental health intact, and being able to recognize when it's not, and reaching out for help and finding it. So again, reducing that stigma.
Absolutely. You got to do it. And you got to get outside. Now it's a nice day and the weather's peaking up out there in Missouri, and it's now 60. You got to get out and enjoy it. It's a good mental health break to be out there.
That's right. It's golfing season.
Well, okay. Cindy, thank you so much for joining us for Healthcare Career Day, and thank you for all the support that Missouri Behavioral Health Council provides to not only our program, but also all the healthcare, behavioral healthcare specialists and professionals in the state of Missouri.